Bismillahirrahmanirrahim. Your Excellency, Dr. Tedros, distinguished guests, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon to you all from the beautiful city of Tashkent. My name is Hayat Sindi. I'm the Senior Advisor to the President of Islamic Development Bank for Science, Technology and Innovation. On behalf of the Islamic Development Bank Group, I would like to express my sincere gratitude for accepting our invitation to join us in this important high-level roundtable during our annual meeting here in Uzbekistan to discuss building resilience through innovation in response to COVID-19 pandemic in the least developing countries. Global health security now tops the agenda for all governments and all multilateral institutions. The challenge of COVID-19 has highlighted the fragility of our pandemic response mechanisms and the human economic cost of inadequate pandemic preparedness continues to rise. The economic cost so far in mitigating COVID-19 is in exceed of $10 trillion. The IDB has attempted to support our member countries during these difficult months, particularly in getting access to vaccines and therapeutics. And we continue to support innovation in developing rapid and accurate testing. There is, however, serious inequity in the access to and distribution of vaccines, and this is the resulting in many countries and regional groupings of countries to ask themselves, how can we build back better? How can we build more resilient health and pandemic preparedness systems? It's now clear that the role of science, technology, and innovation will be critical in strengthening health systems with the development of regional center of excellence based on new partnerships that will expand capacity for the development of new diagnostics and vaccines to address future global health threats. That will also require partnerships to create new manufacturing capacity and rapid delivery mechanisms. This is the challenge for the ISDB and its member countries, and we look forward to working closely with WHO to help shape these initiatives. We are delighted that you, Dr. Tedros, are able to join His Excellency Dr. Aljazeera today for this first roundtable to examine these issues. Now I would like to hand over to our moderator for this discussion, Alan Dowley, the Executive Chairman of Seven Strategy and the Chair of the G20 Health and Development Partnership. Over to you, Alan.
Thanks very much, Dr. Hyatt. And I know we have limited time today, so I will keep my remarks very brief, but I want to congratulate you and His Excellency for having a side event on the important issue of building back better and health system resilience. And I know that His Excellency has been the head of a central bank, he's been an economic minister, and he's now head of the ISDB. And he takes over at an extraordinary time where we've got these existential threats of global health security and climate change facing the world and facing the Islamic community and the member countries. And I think, Your Excellency, you take over, but with your experience, and particularly your experience at the G20, where I know you've attended many of the meetings, probably from the creation of the G20, you're well served to be able to play a major role on the international stage. So these are difficult times, and what we're very interested in hearing as the incoming president of the Islamic Development Bank is what your priorities are and how you see health fitting into that program. And then after you've finished your remarks, I'll be pleased to introduce Dr. Tedros, the head of the World Health Organization. So over to you.
Thank you very much, Alan. I am very honored to be with you on this panel only 3 weeks after assuming my new responsibilities. I am trying to learn as much as I could in the very short time I have had before the annual meetings, so you can imagine. But I was very thrilled to see that there is good cooperation in the battle against COVID-19, and that there is cooperation with the World Health Organization. So I'm grateful also for Dr. Tedros making time to be with us today. Therefore, on behalf of the Islamic Development Bank Group, I want to express my appreciation to all of you for accepting our invitation to this event. Indeed, it will be an excellent opportunity to benefit from the World Health Organization insights on the approaches to building health systems resilience. The discussion will also highlight the IDB's global efforts, how we can be better prepared to prevent future pandemics, and why access to testing and vaccines are fundamental to achieving universal health coverage. The lessons learned from the COVID-19 pandemic and the complexity of the international geographical spread have demonstrated the significant role of locally developed innovations and technology transfer in the fight against the pandemic. Past epidemics have proven that containment efforts are seriously hindered due to the lack of access to appropriate diagnostic tools, essential medical supplies, devices, therapeutics, and vaccines. Yet we face the same challenge again. The current manufacturing capacity, especially in developing countries, is far from meeting global demand. At the same time, the available supply is already being prioritized to meet the demands of more lucrative high-income markets. This imbalance calls for an urgent coalition to strengthen global partnerships to encourage and leverage locally developed innovations and facilitate technology transfer to boost the global resource of COVID-19 diagnostics and other health supplies. This approach helps prepare for future pandemics by building manufacturing capacity in IDB member countries. At the onset of the pandemics, the IDB rolled out its SPR, or Strategic Preparedness and Response Program, a $2.3 billion special financing facility to help member countries prevent, contain, mitigate, and recover from the COVID-19 impact. In addition, a public-private philanthropy people partnership was adopted to ensure the program's success through co-financing and networking. To support technological development and innovation, we also launched the Transform Fund, which calls for innovation, that had invited calls for innovation in 2020 and 2021 through the Engage platform to leverage innovative solutions that contribute to building the resilience of our response to COVID-19. The 2020 call for innovation leveraged 30 innovative solutions with a total budget of $7.33 million in grant and equity financing to mainstream those solutions into the IDB intervention under SPRP. Moreover, the IDB mobilizing several global partnerships on STI-based COVID-19 innovative solutions from crucial partners operating in diagnostics and healthcare technology delivery, including Abbott, General Electric, World Health Organization, FIND, and PATH. These partnerships are meant to respond to shortages of essential healthcare supplies and strengthen the local medical production capacity. The bank has also extended its SPRP COVID-19 response program to include a third component, the IDB Vaccine Access Facility, or IVAC. It aims to help member countries gain access to COVID-19 vaccines. SPR2 adopts a holistic approach focusing on health supply development, manufacturing, procurement, and delivery to end beneficiaries. The objective is to ensure long-term member countries' self-reliance through technology transfer and capacity building. At this juncture, I'm pleased to announce a new joint call with the World Health Organization to fast-track the digitalization of health in the least developed countries. Particular attention would be given to enhancing access to quality health services and taking pressure off hospitals, medical centers, and medical staff. Let me close by saying that I sincerely hope that this discussion will pave the way for a global partnership on strengthening the local R&D and manufacturing capacity of COVID-19 diagnostics and vaccines within the developing countries' innovation ecosystem. However, we need the right partnerships to make this happen. That's why the Islamic Development Bank, through its engagement with global partners such as the World Health Organization, can help identify biotech companies willing to facilitate technology transfer to African countries that have potential COVID-19 vaccine manufacturing capacity through successful PPP models. The IDB will continue its commitment towards supporting diagnostics and vaccine manufacturing to achieve a new public health system. And just one final note, it's not in my statement, but I heard it from most governors today in their interventions in our conference. They mentioned the vaccine divide and the digital divide. Those two divides were mentioned so frequently as being two major problems facing the membership, especially those who are in the low-income area. So I hope we can learn something that we can do more of and help facilitate cooperation and collaboration in the service of these communities. Thank you very much.
Dr. Aljazeera, thank you for very concrete remarks. And I do want to congratulate the work of the bank and your plans for the future in this area of global health security. Yesterday, when we had the H20 summit meeting as part of the G20 process, we had Baroness Scotland, who's head of the Commonwealth, speak at our event. And she said something very interesting. She said, "We're all in the same storm, but we're not in the same boat." And as you've just said, Your Excellency, there is a real problem of us all facing the same storm, but not with the same tools to be able to resolve this. So with that in mind, I'd like to hand over to someone who I think has given incredible leadership in the last 18 months with his team around the world, not just in Geneva, but around the world. So the floor is yours, Dr. Tedros.
Thank you. Thank you very much, Alan. Your Excellency, Dr. Mohammed Suleiman Aljazeera, dear Hayat, Excellencies, dear panel members, Bill and Philippe, good morning, good afternoon, and good evening to all of you. And thank you so much for the invitation to share a few reflections with you today. And I want to start by congratulating my brother, Dr. Aljazeera, on his election as president of the Islamic Development Bank. And I look forward to working with you and with all ministers of finance in IDB countries to respond, restore, and restart. And I fully agree with what you have said. Maybe I may repeat some of the issues. And thank you also for the joint initiative. The COVID-19 pandemic is a once-in-a-century crisis that has taken a terrible toll on individuals, families, communities, and economies. In some public discourse, the response to the pandemic has been framed as a choice between lives and livelihoods, between health and the economy. But this is a false choice. The pandemic is a devastating demonstration that health and the economy are intimately integrated and interdependent. When health is at risk, everything is at risk. But when health is protected and promoted, individuals, families, communities, economies, and nations can flourish. The only way to solve the economic crisis is to first solve the public health crisis. One of the key lessons of the pandemic is that health is not a luxury item or simply an outcome of development. It is the foundation of social, economic, and political stability. WHO remains committed to working with IDB and its 57 member countries to strengthen health systems based on a strong foundation of primary health care in order to narrow the gap, or as what the IDB president said, the divide. Our teams have been working closely for several months on developing a strategic framework agreement, which we expect to sign in the near future. This agreement will support our joint efforts to strengthen health systems, accelerate cancer prevention and control, improve maternal, newborn, and child health, strengthen emergency preparedness capacities, respond to the threat of antimicrobial resistance, and more. Our two organizations will also work closely together to scale innovations with high impact, including through the IDB Transform Fund. I know we have already started to work on scaling innovations in women's cancers, and we see potential to expand into other areas, including mental health, non-communicable diseases, and the use of genomics for outbreak surveillance, and the prevention and treatment of many diseases. Throughout history, innovation has been a major driver of improvements in health, and it remains an essential part of WHO strategy. Innovation is most powerful when it helps to reduce the inequalities in our world, instead of becoming another reason people are left behind. We must be guided by what people need, not seduced by every new gadget. That's why WHO's approach is to identify innovations with the greatest potential for the greatest impact based on the needs and priorities of countries. Let me describe 3 areas in which we believe investment in innovation could make a huge contribution to strengthening resilience globally. First, vaccine manufacturing that His Excellency the President had stressed. More than 5 billion doses of COVID-19 vaccines have now been administered globally. And yet, we face an enormous vaccine injustice that the President also said the vaccine divide. In low-income countries, less than 2% of adults are fully vaccinated, compared with almost 50% in high-income countries. WHO has taken several innovative steps to address vaccine equity. Last year, we established the Access to COVID-19 Tools Accelerator, including the COVAX Vaccines Facility, to speed up the development and equitable distribution of vaccines, diagnostics, and therapeutics. We also established the COVID-19 Technology Access Pool as a mechanism for sharing transparent and non-exclusive voluntary licenses. Most recently, we have established a technology transfer hub for mRNA vaccines in South Africa. But for the long term, we need sustainable local vaccine production in every region to break the dependence on imports and strengthen regional health security. Investing in local production of vaccines and other medical technologies is essential, not for pandemic preparedness and response, but also for a reliable supply of safe, effective, locally produced medicines and for the economic benefits it brings. Second, primary health care. Pandemic response, recovery, and resilience require strong primary health care. And innovation is always important for expanding the geographical reach of primary health care and the range and quality of services offered. For example, in Somalia, WHO has begun to scale a solar-powered oxygen innovation, which is already saving lives of patients with COVID-19, trauma patients, and children with pneumonia. Digital technologies offer many new opportunities to reach more people with primary healthcare services. For example, telemedicine and mobile health are helping us to deliver care in people's homes instead of in hospitals and clinics. Investing in primary healthcare and in innovations that allow more people to access it offers huge benefits for safeguarding health, not just from the effects of epidemics and pandemics, but also from the impact of communicable and non-communicable diseases. I therefore welcome the IDBs Innovation Challenge on accelerating impact in primary healthcare through digitalization. And we look forward to supporting it and to seeing the most mature solutions brought to scale for the greatest needs and the greatest impact. Third, innovative finance. As you know, there have been several reviews of the global response to the COVID-19 pandemic, with many recommendations about how to prevent a future disaster on this scale. One theme that's common to all of reviews is the need for better financing for national and global preparedness and response. There is no doubt that strengthening resilience, especially in low-income countries, will take significant investment. In our view, it's vital that any financing facilities are built on the foundation of existing financial institutions, rather than creating new ones that would further fragment the global health architecture. That includes the World Bank and the International Monetary Fund, as well as regional and multilateral institutions, including the Islamic Development Bank, who have the ability to mobilize resources both globally and domestically. So we would welcome the Islamic Development Bank's commitment to investing in strengthening pandemic preparedness and response. With the UN General Assembly in September, the G20 summit in October, and the special session of the World Health Assembly in November, the next 3 months will be a critical period for shaping the governance and finance of pandemic preparedness and response. Whatever structures and mechanisms emerge, WHO believes this must be grounded in several core principles: engagement and ownership of all countries, alignment with the constitutional mandate of WHO rather than creating parallel structures, involvement of partners from across the One Health spectrum, civil society, the private sector, faith-based organizations, and so on. Coherence with the international health regulations and accountability. Thank you once again, Dr. Aljazeera, and thank you, Your Excellencies, for your support and commitment. And thank you, Alan. At no time in human history is the relationship between health and finance more vital, or the need for our partnership greater. I remind you of my 3 requests where I truly believe could make a difference. Invest in local production, invest in primary health care as a foundation of universal health coverage, and invest in pandemic and preparedness and response nationally and globally. We must seize the moment. If the world continues down the same path, it will continue to get the same result, which is a world that's less healthy, less safe, and less fair. Now is the time for new ideas and for working together in solidarity to build a future that's healthier, safer, and fairer for everyone, everywhere. Shukran jazilan, and thank you. And back to you, Alan.
Dr. Tedros, thank you very much for those very comprehensive remarks. And one thing that I think, and also to His Excellency, the ISDB President, I think there's a great deal of convergence between what you both had to say and what, as you know, Dr. Tedros, I like very concrete outcomes for any meetings that we have. And so one of the things I would like to propose to you and to His Excellency is that there should be an early meeting hosted by the Islamic Development Bank with member countries from the Islamic community and the World Health Organization and other partners to have a look at this issue of local production, of regional hubs, of pilots, to address the two things that Dr. Aljazeera said, which is the inequity in vaccines and the digital divide. And I'm sure with the support of Dr. Hyatt and with the political leadership of Dr. Aljazeera, we could put together very quickly a group of people to see how we can explore creating new pilots, Dr. Aljazeera, across the Islamic community and the family of Islamic countries who are part of the ISDB. So I'd like you to think about that, and perhaps a little bit later we can comment on it. And also, by the way, about the blended and innovative financing initiatives of the Islamic Development Bank, which are fantastic. I mean, on the climate change issue, of course, the issue, the Green Sukuk, which is a fantastic innovative initiative. And it may be that we could do something similar, Dr. Aljazeera, when it comes to global health security. So we'll come back to this, but I want to move on because we haven't got a lot of time. We've got three of the most important organizations, in my view, who use innovation to accelerate health equity, joining us for this panel discussion. And that is the CEO of FIND, which is the Global Diagnostics Alliance, Dr. Bill Rodriguez, Dr. Philippe Duncan, the CEO of UNITAID, which has played an extraordinary role in using innovation to tackle some of the most chronic health conditions in low and middle income countries. And Philippe is now also playing a leading role in the ACT Accelerator in relation to therapeutics and diagnostics and so forth. And then we're very pleased to welcome Dr. Nanthalil Mugala, who's the head of the African region of PATH. And of course, PATH is an organization that has played an incredible job, particularly in the area of digital health, and who I know is an important partner for the Islamic Development Bank. So I'm going to ask Bill, first of all, to say some remarks, then Philippe, and then Nanthalil. And then we'll get into a discussion with Dr. Tedros and with His Excellency. So over to you first, Bill.
Thanks so much, Alan. And to His Excellency, the President, to Dr. Tedros, Dr. Hyatt, Your Excellencies, Alan, Philippe, and colleagues, thank you so much for inviting me to discuss these important issues. We've had the privilege at FIND over the past several months now with working with Dr. Hyatt to think through some of the opportunities and challenges of really harnessing innovation and technology development outside of the regions where they've been dominant to date, and really trying to build equitable access to technologies through R&D across all regions of the world. There's a quote I've been using a lot recently, which comes from 20 or 30 years ago, which is that the future has arrived, but it's just not evenly distributed. And I think that's the critical issue we're trying to address, is how do we make sure that all innovation can be equitably distributed? And that starts with making sure that early stage R&D and development happen across the world in regions where they haven't recently. Let me just make three brief comments that align closely with His Excellency's comments and Dr. Tedros' comments as well. The first is, as critical as the digital divide and the vaccine divide is, we see the same thing in treatments and diagnostics under COVID. And I'm sure Philippe will comment on the treatment divide, especially around access to oxygen. But the testing divide is real, and we've seen that dramatically over the past 12 to 18 months. When you look at how rapidly testing has been implemented across high-income countries, we see a dramatic inequity of between 20 and 4,000 fold. So there's 4,000-fold less testing in many countries in the world than there are in the countries in Europe and North America that test at the highest rates. And that extends across much of the EMR region where many of the Islamic countries reside. So it's really a global problem of equity, and it starts with where the innovation and the production happen, and that's clearly true in testing as much as it is in vaccines. The second is this issue of local manufacturing. And Dr. Tedros, we appreciate your leadership in driving this issue, and especially in pushing the vaccine production globally. For testing production through the ACTA accelerator, which has had global support, we've been able through FIND and our partners at the Global Fund and Unitate and others to really try to drive this issue for testing production. So we've just now launched 2 agreements, one of which is to bring manufacturing technology for testing, rapid testing, PCR testing from European manufacturers to Senegal. And Dr. Amadou Sall, who's the leader of that effort in Senegal, is now developing what will be the first full-scale end-to-end production facility on the African continent for testing. It should be ready early next year. It's been a $25 million program that's had broad support globally. And it's the first step of many to really make sure there's equitable production of testing across the world. And then the last thing I'll say is we really appreciate the opportunity to support this innovation challenge on digital health. We've been actively engaged in linking testing results to treatment and care and providing those linkages. Digital innovation is critical to that, and we're proud to really support this effort. We think it's critical, and we look forward to seeing a lot of new innovation coming out of the Islamic countries, and especially to work closely with ISDB to try to drive innovation and help build that strength into something that can really be used and accomplished locally in the countries that haven't had access to those innovations to date. So I'll stop there, Alan.
Thank you so much, Bill. I'd like to move on to Philippe, Dr. Philippe Duncan, who was actually involved very much in helping to found UnitAid back in 2006. And so he's seen the way in which this whole health space has evolved now into this terrible pandemic. And Philippe, you're playing such a central role in the issue, particularly of therapeutics. And I just wonder what your reflections are, because you've got such wide experience on how we build back better and what the challenges are. You're on mute, Philippe.
Yes, I think you can hear me now.
Yeah.
Yeah, thank you. No, thank you, Alan, and thank you all the colleagues and friends, and in particular, Your Excellence, Mr. President, and Dr. Tedros, and of course, Bill and others. No, I think that what I've learned, I've heard this morning is making perfect sense. Just to mention that the link with innovation and how to strengthen the health system is clear for us, where, as United before the pandemic, we reach more than 100 million persons every year. We accelerate by 3 years the response for the 3 diseases. And the savings is already, because of the price negotiation, we saved 2 billion over the last 5 years and more than 3 billion expected in the next 7 years. But more important, I think that innovation play a key role on the resilience of the system, because thinking about better tools, better treatment, simplified diagnostic, increase the way we reach the people in a good way, decrease the burden on health workers, engaging also on community-based intervention. So when we think about health system strengthening, we should not think about the system. We need to think about the people, including the health workers. Addressing the pandemic and the current and for the future, my colleague of WHO yesterday said that it's about addressing fear and uncertainty to build the trust. I think that I would add something about justice to build the trust. And obviously, access is a key issue, access to the response, the product, And there is an imbalance and an injustice currently that we see. Every progress we are making increase the inequity potentially if we don't cover the needs, not just from a part of the world, but for all the people, all the countries in the world. And one of a way to address this injustice, it was mentioned, but I will come back to that, is the diversification of the production. And we are working on that, talking on that, because it's also our experience as an organization since the beginning in the 3 diseases, but of course for HCV that affected a lot of Islamic countries, and we have the tools to fight about that. Women and child health, including, for example, cervical cancer. UNITED has responded to the call of Dr. Tedros into that at the first place, that more need to come. But looking at the COVID-19 response for therapeutic, there is a need, for example, to expand potential treatment with small molecule. And we know how to do that. We know that using the diversity of production and create a healthy and quality generic market. We have done that with ARVs. We just need the IP solution through the medicine patent pool, for example, articulating with the CTAP, and this will work. But we see not a lot of progress from the industry part, so we need to push them to agree on that. For the biological product, in particular for the monoclonal antibody that can play a big role in the response of COVID-19. Again, in that case, we need tech transfer and cooperation with originator and biosimilar. We're working on that with WHO. We see some move, but it's too slow. So we need to really focus on that. In terms of tests, I think that Bill mentioned the joint work that we are doing in supporting transfer technology. It's feasible. It is key that, of course, countries in the South can secure the volumes and secure different type of location. And also, we have a close look in terms of the platform mentioned by Dr. Tedros, in particular in South Africa, together with WHO and the MPP to expand, of course, the technology, including the vaccine on RNA messenger. So just to reinforce the fact that we are welcoming this initiative from the bank, we are fully on board. One thing I want to say is that to achieve that, we need to work in strong partnership. We have the experience to work as UNITED with WHO. Of course, we are hosted by WHO, but also strong relationship with FINE and PAF. And so we are looking forward and happy to work with you to make this happen. Over.
Philippe, thank you so much, and thanks to you and your team at UNITAID for the incredible work they've done to help save lives around the world in low-income countries. I'm very pleased now to invite Dr. Nanthalil Mugala, who's the head of the African region for PATH. So, Dr. Mugala, you have the floor.
Thank you very much, Alan. And thank you very much, Dr. Aljazeera and Dr. Tedros. And I also want to recognize my fellow panelists. It's really an honor for me to be part of this esteemed panel. I'm joining you today from Lusaka, Zambia. I'm very pleased to be part of this panel to discuss also this very, very important topic and innovation, building resiliency through innovation in response to COVID-19 is definitely a topic of great priority for us as PATH. We are over a year and a half into this pandemic, and while we know that astonishing achievements have been accomplished, the majority of people around the world still don't have access to many of the innovations that are needed to tackle COVID, and we remain vastly underprepared to deal with the future health threats. My short remarks today will focus on 3 areas where greater investment could have a huge impact in responding to COVID and preparing for the next crisis. Firstly, we must continue to invest in innovation, and I think this goes without saying, innovation and manufacturing, and I know Dr. Tedros did touch on this. All indications show that it is likely COVID will be with us for decades. We have an opportunity to take a step back and ask ourselves the question, what are the investments that we would make if we knew that COVID would be with us for the next 30 to 40 years? One area would be a greater focus on manufacturing, and I think this has been alluded to. The pandemic has obviously exposed severe gaps in manufacturing in many regions of the world, and especially the African region. Africa needs continental and regional plans and collaborations for strengthening the ability to develop, register, and manufacture drugs, diagnostics, vaccines, and other biomedical products. We know that we can no longer rely on global partners and supply chains to provide these essential goods. With the world's fastest growing population, Africa needs to strengthen capacity for product development, registration, and Africa leaders, it goes without saying, must prioritize this area of investment. Initiatives being championed by organizations within the Africa region, such as the Africa CDC and other member states, should be advanced and supported, including financially. Financial aspects is a critical area where we need to make progress in order for us to achieve some of these key objectives. Secondly, we must prioritize resources for community engagement and community-led solutions. We know also from recent epidemics, including Ebola in West Africa, that when we do not defer to the support of communities, vaccinations and other interventions are not as effective in actually stemming outbreaks before they become widespread. Experience has also shown that countries that utilize existing community systems originally developed for Ebola and malaria were better placed to respond to the COVID-19 pandemic. Community health volunteers are indeed a critical link to communities at risk and in the implementation of surveillance system at the community and household levels. As we have witnessed in a number of countries across a number of health priority areas, including malaria, yet very often, these are not compensated for their time, travel, or reporting. In fact, it's very interesting that statistics actually show that about 86% of community health workers in Africa are receiving little or no compensation at all. Community health workers must be incorporated fully into the health system, and any financing to support pandemic preparedness and response, and must include allocation of resources for these critical positions in the front line. So in general, investment in human resource capital for health is an area of critical importance. Finally, we must embrace and invest digital health. And this again goes without saying. Digital tools and approaches and the data they unlock are an essential enabler in global health security. They allow ministries of health and global bodies like the WHO and others to prepare for, predict, mitigate, and respond to a range of potential health emergencies, from disease outbreaks like Ebola or COVID-19 to climate change and antimicrobial resistance. The use of digital health and data can provide real-time, reliable, accessible insights that stakeholders need. And indeed, COVID-19 has demonstrated the importance of global data sharing and transparency. Health emergencies often impact more than one country, and the global community, from normative bodies to general population, want to understand the situation. Therefore, greater transparency and availability of reliable health data allows the global community to not only understand, but to support the response. So with these few remarks, Alan, thank you very much for the opportunity for me to speak. Thank you. So back to you.
Thank you so much for those comments. And, there is a real crisis of a lack of frontline healthcare workers around the world at the moment. And of course, it's particularly affected in terms of COVID-19, women frontline healthcare workers who are often the key breadwinner in their own family. Well, look, I'm conscious that I'm going to ask Dr. Hyatt in a few minutes to sum up, but what I'd like, as you know, I like things to be relatively concrete, and while I don't expect His Excellency to sign up to something today without having it fully discussed, I do think one of the things we could at least try to move forward on in principle is that perhaps later this year or under the presidency of the Indonesian G20, with the support of the Islamic Development Bank, that we bring these experts together, Dr. Aljazeera and Dr. Tedros that you've heard today, these three fantastic organizations and some others, to talk about how we can address the things that you raised in your speech, Your Excellency, and the points that Dr. Tedros raised, because what we need now are concrete actions. We need to look at what can be delivered in terms of regional manufacturing, improvements in science and technology and innovation. And then, of course, what we haven't really talked about is distribution, getting things to people concerned. So I'm going to ask Dr. Tedros first just to respond to this, if he'd like to say a few words, and then not to put you on the spot, Your Excellency, but perhaps you may want to say a few words on it. And then I'm going to hand over to Dr. Hyatt to round this session off. So Dr. Tedros.
Yeah, thank you. Thank you so much, Alan. This is a very interesting panel, and thank you for bringing us all together. And I fully agree that concrete steps are very, very important. And on local production, especially the area where we have said there is a need for local production, I think having regional hubs is very, very important. WHO has been advocating for local production before even COVID to address the other health problems and needs for vaccines. And what's happening now is COVID stressed even the need more clearly. So we hope the COVID experience will accelerate the investment in local production. We have a unit, a local production unit in WHO, and we're supporting countries. And one of the regional hubs now we have established is the one in South Africa for technology transfer. And there is now interest from other regions also to have regional technology transfer hubs. Of course, while establishing regional hubs, we're supporting as many countries as possible who need support from us. From Africa alone, we have 3 front runners now: South Africa, Rwanda, and Senegal. But there is also Egypt and Nigeria. And from Latin America, we have Brazil, and we're partnering with institutions from there. And also in Asia, we're partnering with Indonesia and Bangladesh and others. So anyway, I don't want to take much of your time. We're already partnering in local production with as many countries as possible. And we're trying to organize it as a regional hub. And the first of its kind is in South Africa. And we can partner in expanding regional hubs to other regions. So that could be one concrete step that we can do together. And there is a lot of interest. And I heard from Indonesia recently that they will do everything to be the next hub for local production, for technology transfer. So that's what I would like to contribute, and look forward to work with IDB to invest on local production through regional establishment of regional hubs. And to address the digital, the vaccine divide, as the president said, not only for now, but strategically. Thank you. Alan, back to you.
Thanks, Dr. Tedros, for those remarks. As I say, I don't want to put you on the spot, Dr. Aljazeera, but perhaps these are ideas you'd like to take away and discuss within your executive team. And but I think you can see there's a huge willingness here to work with you and your member countries to see if we can help in these, both in the issue of vaccines, therapeutics and diagnostics, but also this digital divide. So perhaps you would like to take these ideas away, and we would be very happy in the G20 partnership to also help you with this. You're on mute, Your Excellency.
Can you hear me now?
I can, yes, thank you.
Okay, sorry. Thank you very much. Briefly, what I've heard from Dr. Tedros and the others is music to my ears. I'm very cognizant of the need to shield as much as possible our member countries from this vacuum they found themselves in when demand for from masks to the therapeutics and then swabs and then vaccines, we felt helpless. Even though I've only been in the institution for 3 weeks, but I heard all the stories. And I think this is something that it's incumbent upon all of us to try to do as much as we can, not to allow this to happen again in the future. And we can only do that by this local content approach. And thank you, Dr. Tedros. I will call you. We will discuss even further, because I think we can lead. The Islamic Development Bank can lead with ideas, with finance, with bringing partners together. We have modalities where we can bring partners together to cooperate, collaborate, and do something. And as you know, there has been, and the debate hasn't ended, about the monopoly of patents, and that you with health like the one we are approaching now. It's hard to say, well, no, sorry, I can't share my patent, even though you're going to pay for it, but I'm not going to share it. I'm sure Dr. Tedros has been burning lots of midnight oil worrying about these types of issues. I will be very happy to discuss them. We want to support local content, local production of these essentials for today and for tomorrow. And we want to do it in a way where the private sector is involved, also the governments are involved. So we're in the process creating jobs, we're creating green economy. We have a holistic system here now at the Islamic Development Bank, and it's an open system. We welcome everybody to come and partake. So I look forward to cooperating, and I thank you, Alan, for raising this. And Dr. Tedros, we have a lot to talk about.
Dr. Aljazeera, thank you very much. A new paradigm, I think we're looking at now for the immediate future. I'm going to hand over now to Dr. Hayat Sindhi, who's the Chief Scientific and Technology Advisor to the President of the Islamic Development Bank. Dr. Hayat is one of the most extraordinary people I've come across in my time chairing the G20 partnership, and she's driven the science and technology agenda very effectively. And she is one of our goodwill ambassadors for the G20 partnership. So thank you for your work, Dr. Hayat, and I leave it to you now for the concluding remarks.
Thank you, Alan. Thank you, everyone. I've been listening carefully, and I've been putting some notes here. This has been an excellent and informative discussion, really. It's like May Day. We were waiting for this to happen a long time ago, and I'm glad all of you made it happen. Thank you, Dr. Aljazeera, Your Excellency, Dr. Tedros. Thank you, Alan, Phil, Bill, Nanthil, for your insights. As I heard from all of you, the critical role of digital solutions is in improving primary healthcare and data gathering so that we can probably measure and assess the impact of a new pathogen is a key focus for the public policy. On Monday, the Digital Public Goods Alliance, alongside with the Rockefeller Foundation and the Norwegian Ministry of Foreign Affairs, brought together leaders from around the world to frame an ambitious, truly collaborative agenda for building digital public infrastructure. Next year, Indonesia assumes the presidency of the G20, building on the excellent work of Saudi Arabia last year and Italy this year. It is an opportunity to focus on the promotion of science and innovation in the area of health so that we can be able to build the tools necessary to tackle future pandemics, including those non-communicable diseases of diabetes and cardiovascular disease, which is the single greatest killer in humanity. I believe under His Excellency's leadership of the ISDB, we will be able to assist member countries and partners from around the world to work with the Indonesian presidency of the G20 to establish the framework necessarily to address today's global health challenges and prepare properly for what the future may brings. We talk about blended finance. Blended finance using Islamic finance principle has so much potential in helping the world to meet SDG, including, of course, health. Partnership is essential here because partnership can be used to mobilize private sector resources, donor government, as we hear from His Excellency, to boost development while promoting cooperation among member countries. Now, I want to elaborate on His Excellency announcement earlier. It's an announcement to join call for innovation between ISDB, WHO, Unit 8, Find and Path. A competition to promote digital public health, public goods for the transformation of local health system for greater access to quality and affordability of care in the least developing countries. This call for innovation will invite local digital entrepreneurs to submit a vision, plan and process sustainable business model to adopt and adapt digital health, global public goods into local, as we heard from Excellency, local goods, sustainably accelerate the digital transformation of local health system for greater access to quality and affordability of care, including high quality diagnostics. This competition will be the competition will award 2 entrepreneurs of $100,000 for each for the most practical and innovative initiative to accelerate digital health transformation in a local community. The call will be open this year in October 2021, so please save the date and please apply. We will work closely with Unit 8, Path and Find to promote the competition, and we hope that Dr. Tedros, that we will join His Excellency Dr. Aljazeera in presenting the award to the 2 winning submissions. I want to thank you all for participating, and I want to thank you all teams for making this happen. WHO team, ISDB STI team, ISDB Thiqa team, and of course, Alan team from Sovereign Strategy, and all of you from Find, from Path, and from Unit 8. Thank you very much for joining us. Please stay safe, and we'll see you in the next event. Take care.